Hello, my name is Dr. Dewan S. Raja. Today I will discuss about heart block. What is heart block? That is the impairment of conduction of an impulse in the heart excitation. It is often applied specifically to the atrioventricular block. We know that our heart has conducting system like SA node, AV node, bundle of His, right and left bundle branch, then Purkinje fibers. SA node is the pacemaker, and AV node, atrioventricular node, is the gatekeeper for the passage of impulse from the atria to the ventricle. Sometimes some impulse from the atria may not go to the ventricle or maybe go in a delayed fashion. So in that condition, we call it heart block. What diseases may cause heart block? Ischemic heart disease, rheumatic heart disease, congenital heart defect, infectious heart disease, and heart failure. After open heart surgery are all conditions that can occur in heart that may be related to heart block. What drug may cause heart block? Digoxin, beta blocker, calcium channel blocker. What drugs stimulate the passage of impulse through the AV node that will actually help to overcome the heart block? These are the atropine and isoproterenol. Okay, that will stimulate the passage of impulse. So this is the treatment in many cases for heart block. Okay, let's start. What are the types of heart block? We have the first degree heart block, second degree type 1, we call it Wenckebach or Mobius type 1, the Mobius type 2 second degree heart block, and the third degree heart block. We have 4 types of heart block. How about first degree heart block? Okay, first degree heart block. We have here prolonged PR interval. PR interval from P, beginning of the P, to QRS complex from here. Okay, it should be always less than a box, big box, or should not cover more than 5 smallest box. Okay, so it should be around 2.0 second, around 0.20 second, around 0.02 second, because the smallest box comprises 0.04. So 5 times 0.04 equal to 0.2 second. So our PR interval should not exceed this distance. So here it is exceeded, here it is exceeded, here it has been exceeded more than a big box. Okay, so this is the condition called first degree heart block. Okay, consistent prolonged PR interval greater than 0.20 second. PR interval measured from the beginning of the POA to the beginning of the QRS complex. So our textbook guidance physiology also tell it as not PR interval, maybe PQ interval, maybe more appropriate. The PR interval normally should be less than 1 large square. 1 large square means this. Okay, first degree heart block results from prolonged physiologic block in the AV node. Possible causes are medication, Okay, like that of beta blocker, calcium channel blocker, digoxin, vagal stimulation. Okay, that also cause first degree heart block. And diseases, we have just discussed a lot of diseases of the heart, okay, that may lead to first degree heart block. Okay, we got that. Now we'll go to the second degree heart block, Mobius type 1, also called Wenckebach. Okay, what happens? Peer interval lengthens. Peer interval lengthens. It is lengthening. Okay, it is lengthening. Okay, until a beat is dropped here. QRS complex is missing, so beat has been dropped. Progressively prolonged PR interval, then a drop, usually asymptomatic or maybe symptomatic. Okay, we got that. There is the second degree heart block, Mobius type 1, Wenckebach. So how can you remember? Prolonged drop, or prolonged, then drop. Prolonged means what? Prolonged PR interval. So another progressive prolongation of PR interval. Then there is a drop bit, that is the second degree heart block, Mobius type 1, Wenckebach. So prolonged PR interval, prolonged PR interval, then drop in the then there is a drop bit here. The QRS is missing here. There is the second degree heart block, Mobius type 1, Wenckebach. Second degree heart block, Mobius type 2. Okay, Mobius type 2 PR interval is the same, not prolonging like the type 1 in all conduct bits. Drop bits that are not preceded by a change in the length of the PR interval excuse me, may appear as 2:1, 3:1, 3:2, or 4:3 block. There are grouped bits with one bit drop. So one bit drop here, group, then here another drop bit. There is always a pathology. It may turn into a complete heart block. Okay, that is the second degree heart block. Now we'll go to the third degree heart block. Here there is no correlation between atria and ventricle. Atria and ventricle contracts independently. A complete block to the excuse me, a complete block to the AP node. The atria and ventricles are firing separately. Both P and QRS complexes are present, but they have no relationship. It's a chaotic situation. We have P. P to P is regular. QRS to QRS is regular, but P is not correlated to QRS. Atria do not control the contraction of ventricle. Both P and QRS complexes are present, but they have no relationship. May be caused by Lyme disease, parasitic disease, may be caused by Lyme disease or any other disease. Treated with pacemaker. You need pacemaker here. And that's all about the heart block. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice and wonderful day. Bye now.